Hey guys, how have we all been? I'm super sure I'm super excited, and I know we are all doing very wonderfully fine. Bless you all. My name is Violet Okolacha. I actually talk about everything about Osce and nursing here in the UK. Bless you all guys. A massive congratulations to my colleagues and my friends who passed their Osce exam. I got 7 mails this week. I passed. Thanks for your help. Guys, I'm super proud of you all. Nurses are really intelligent and wonderful people. Bless you guys. So today I'll be doing a video on assessment, and this assessment I'm going to be talking about is the planning. We are all aware that 4 new cases were added to Osce, 3 skills and 1 case scenario for your assessment. And we have vitral infusion phlebitis as one of the skill, we have NG tube as the second skill, and we have pressure risk assessment as your pressure sore as the third skills. I've done the videos on them all, but I got a lot of messages about nursing plan for fall and fracture, and I found it useful to do a video to enlighten us. And before I would do that video, I'd like to give you a scenario. Fall and fracture falls under your assessment, and we all know assessment is 15 minutes. Your assessment is complete 15 minutes, or rather 12 minutes. So when we talk about fall and fracture, it means the patient had fell. Now, this is similar to your GCS. In your GCS, the patient falls with their head, sustained subdural hematoma and stuff like that. But in this fall and fracture, the patient fall and could fracture the femur or could fracture the ribs, but there risks a fracture. That is just the difference. There risks a fracture. So this is a simple skill. I'm going to be starting this skill, and I'll be giving you a scenario to help you understand the skill. But guys, if you don't understand what I've said, feel free to ask me any question. The thing is, I'm passionate about my colleagues. Every one of us, we are all colleagues as long as you're a nurse practicing in the UK. I'm passionate about us, and I'm passionate about every one of us passing our Osce, at least at first attempt. So feel free. That's why when I saw the email, I keep seeing the email, I keep seeing the messages. Please do a video on nursing plan for fracture and fall. So I'm very happy to help out in any little way I can. And I'm so sorry for a lot of people who have been asking me to do a video on catheterization. I would have done the video, but the manicure I ordered has not come. So don't worry, as soon as it comes, I'm going to do a video on catheterization. So guys, let's get started on nursing care plan for a patient with fracture and fall. Is the same with any other nursing care plan. Is the same. So I'll be giving you a case scenario just for you to understand it better. This is my formulated case scenario. Mrs. Elik had osteoporosis over 10 years ago. Patient had a fall 2 days ago and fractured the right neck femur. Patient is for possible external physician, and patients usually experience urinary urgency. Please plan for safety. Perfect. This is one of my formulated scenarios. So in your planning, in your assessment, the case scenario you are having is fracture and fall. The case scenario could be like this. As I said, it could be similar to this. And you've assessed the patient. Now you move to the planning station. They want you to give a care plan. So guys, for me, I would use 1, pain. Doing your assessment, definitely. While interacting with the patient, what brought you to the hospital? And you're able to ask, and the patient tells you, I'm having pain. Of course, pain is paramount in this case, because for fracture and fall, pain is number 1. That's why I said fall and fracture assessment is similar to GCS. The only difference is there is a fracture. And sometimes when you have this scenario, the patient may not be going for any surgery. So please take note of that. Like the scenario I gave you, they said patient is for possible external physician. In some scenario, they will not tell you anything about surgery. And in this case, possible. So it's not immediate. It's for possible. So whether they tell you the patient is going for surgery or the patient is not going for surgery, all you need to know in this case is that there is a fracture. There is a fracture. So now, if you feel there's a need for me to do the assessment on this patient, let me know. I'll be happy to do the video on the assessment. But otherwise, over 4-5 persons who has asked me for this video, they've just asked for the planning, and so I'll be doing a planning on this scenario. So Mrs. Ellie Bruvard had osteoporosis over 10 years ago. The patient had a fall 2 days ago, and the patient fractured the right neck femur. This patient now is for possible external physician, and the patient usually experience urinary urgency. So from merely reading this case scenario, what will be your plan? I want you to give me 2 nursing care plans from merely reading this scenario. Now, I've assessed the patient in my assessment, and this patient told me she had a pain of 7/10. So with this I've given you, what will be your plan? Because once fracture and fall comes to your mind, already you have 3. I can give you 4 care plans from this fracture and fall already coming to your mind. So I'm going to be doing 2, and give me 2 care plans outside what I've given you. Work on all of them and prepare just in case you have it in your assessment, because it is what you assess a patient for. That's what you're going to be obviously having for the planning. And like we all know, planning is 15 minutes. So for these patients, before I start my nursing care plan, I always advise something. I always advise you write your name, you write your signature, and you write your date on both planning paper or document that will be given to you. Before you start your care plan, endeavor to write your name, endeavor to write your signature, endeavor to write the date before you start. Now, patient details. My patient is Ellie Brooks. The date of birth is 15 February 1940, and the hospital number is 10010. So my first care plan is Mrs. Ellie is having pain with a pain score of 7/10 due to right neck fracture. Because they said the patient had right neck femur fracture. So my care plan is Mrs. Ellie is having pain with a pain score of 7/10 due to right neck fracture. Somebody will say, how did you get 7/10? Yes, I told you during my assessment with the patient. After assessing the patient, I told the patient, are you having any pain? And the patient said yes. And I said, will you assess your pain for me using the pain assessment 2, where 0 is the least and 10 is the highest. And the patient said, I have a pain score of 7/10. So my nursing problem is Mrs. Haley is having pain with a pain score of 7/10. What will be my aim of care? Mrs. Haley is going to verbalize relief of pain with a pain score of less than 3/10. Mrs. Haley is going to verbalize relief of pain with a pain score of less than 3/10. Now, re-evaluation date. To be re-evaluated today, write today's dates, the date of the exam or the dates given to you. So to be evaluated today, let's say 5th of May 2021, every 30 minutes, and as the clinical condition changes. Tick. That's a perfect care plan. Now, Imatarid makes your care plan very simple. If you've not seen my video on Imatarid, go to my video on Imatarid. It's really lovely. It makes your care plan easy. Now, E, explain and discuss all aspects of care to Mrs. Haley and gain consent. Emu, before I tell you Emu, this patient in the assessment had a new score of 5. So, new score of 5, how frequently do we monitor? You don't need to cram it. Go over your vital sign and go over at the back. It states there, new score of 5 or more. We monitor what? Hourly. So, I will monitor. So, my next one is Emu. Monitor and record Mrs. Haley's observation every hourly according to News 2 policy and escalate as needed. Tick. Perfect care plan. And the next one is what? A, assess. Assess Mrs. Haley for pain using the pain assessment 2. Assess Mrs. Haley for pain using the pain assessment 2. And the next one is what? T. The patient is in pain. What do you teach? You teach brief breathing exercises. Yes, you teach diversional therapy and you teach repositioning. So teach Mrs. Haley the breathing exercise, diversional therapy, and repositioning. And the next one is what? A. Administer all prescribed medications and monitor its effectiveness after 30 minutes. Now, remember in our re-evaluation, what did we say? We said to be re-evaluated today. You write today's date. Every 30 minutes and as the clinical condition changes. Now you can see why we put every 30 minutes, because obviously in the administration of medication we said administer or prescribe medication, and once you administer a medication you have to monitor its effectiveness at least afterwards after 30 minutes. So tick. Now the next one is what? Arrow. Who are we referring Mrs. Haley to? You have to refer Mrs. Haley to what? Orthopedic team and surgical team. Now, why surgical team? Because we are told in the scenario I gave you that the patient is for possible external physician. So refer Mrs. Haley to orthopedic team and surgical team. And the next one is what? Inform. Inform Mrs. Ailey to you what? To use the call bear. And finally, D, document all care plan. Guys, if you do your nursing care plan like this, you are good to go. You're top notch. More than the sky is your limit. Not only are you going to be successful, you are going to be very, in fact, more than the sky is your limit. Now, what is the patient self-care activity? Remember in our I said explain and discuss all aspects of care to Mrs. Ailey and gain consent for all intervention. So Mrs. Ailey verbalized understanding of her treatment plan. 1. Mrs. Ailey verbalizes understanding of her treatment plan because you told her what you want to do and you gain consent. Number 2, Mrs. Ailey consents to what? To treatment. And when we are talking about assess, we said assess patients using the pain assessment too. So my third self-care activity is going to be Mrs. Ailey understands the pain assessment to use. Of course, she understood it because you told her 0 being the least and 10 being the highest. So Mrs. Ailey understood or understands the pain assessment to being what? Use. And when we talked about T, when we said teach Mrs. Ailey deep breathing exercise, teach Mrs. Ailey diversional therapy, and teach Mrs. Ailey repositioning. So my self-care activity will be Mrs. Ailey participates in her plan of care. Yes, she participates because you are teaching her deep breathing exercise and she will breathe in and breathe out. So Mrs. Ailey participates in her plan of what? Of care. And we said refer Mrs. Ailey to orthopedic team and surgical team. Mrs. Ailey understands the reason for referral. That's going to be my self-care what? Activity. And we said inform Mrs. Ailey to use the call, but Mrs. Ailey understands or Mrs. Ailey is able to what? To use the call bear. So guys, this is really simple. Now you could have some issues if you are writing self-care activity and you don't put some important things. For example, you see you didn't write in the plan, you didn't write refer patient orthopedic team, and in the self-care activity you are writing a referred patient understand reason for referral. It doesn't match. Or maybe you didn't write inform patients to use the call bear, and in the self-care activity you are writing patients can use the call bear. It doesn't match. I don't know if you understand. So it is what you plan, that's how you get your self-care activity. Okay, so use the matter read and plan like this. If you have any question, feel free to pop it up. Now the second care plan I would have used, because we are told that this patient haven't had osteoporosis for over 10 years. So apart from the osteoporosis, any patients that ask fracture, they are at risk for fall. Imagine the patient fractured the femur. So the patient is even at risk for what? For fall. So the next care plan is what? Mrs. Ailey is at risk for fall due to what? Right neck fracture and osteoporosis. What will be my aim of care? Mrs. Ailey will be free of falls. If you like, you can add throughout her hospital stay or me personally, I like simplify things. So Mrs. Ailey will be free of what? Of fall. What is our reevaluation date? Because fall is something that you can't, it's not quick to reevaluate. So to be reevaluated today, you write today's date, maybe 5th of May 2021, every 4 hours, and as the clinical condition changes. Number 1, explain and discuss all aspects of care to Mrs. Ailey and gain what? And gain consent. So in your self-care activity, it will be Mrs. Ailey understand or verbalize understanding of her plan of care, and Mrs. Ailey consents to treatment. Now the next one is monitor. And I said this patient had a new score of 5. And we all know if a patient has a new score of 5, according to the News 2 policy, you're going to be monitoring what? Hourly. Someone will say, where did you get that for hourly? When you see your vital sign chart, turn to the back. It tells you the score and the frequency. So my patient obviously has a new score of 5. So I'm going to be monitoring her what? Hourly. So monitor and record Mrs. Ailey's observation hourly and escalate as per News 2 policy. The next one is A, assess. Assess Mrs. Ailey for 4 using the 4 weeks assessment what? Assessment 2. The next one is T, teach and orient Mrs. Ailey to the hospital environment, to person, to place, and to what? And to time. The next one is administer. Administer all prescribed medication and monitor its effectiveness afterwards, after 30 minutes. Perfect. The next one is what? Arrow. Yes, the next one is arrow. Refer Mrs. Ailey to the pain assessment team, refer Mrs. Ailey to the orthopedic team, and refer Mrs. Ailey to the what? Surgical team. Why surgical team? Why did I use surgical team? Because they said the patient for possible external physician. And the next one is I. Inform Mrs. Ellie to use the callback. Document all care as what? As planned. Now, for patient self-care activity, Mrs. Ellie verbalizes understanding of her plan of care because obviously you've explained to her what you want to do, and Mrs. Ellie consents to treatment. Then Mrs. Ellie actively participates in her plan of what? Of care, because you taught the patient. What do you teach the patient? We taught Mrs. Ellie how to you do what? How to use. So we taught Mrs. Ellie and oriented her to our what? To our environment. That's what we taught her. And so your self-care activity will be patient verbalizes awareness of the hospital environment, because we taught and oriented her to the hospital environment. So patient verbalizes understanding or verbalizes awareness of the hospital environment. Patient is able to use what? To use the callback. Patient understands reason for what? For referral. That's it. And patient tolerated all medications administered. That's it. So for any care plan you write, and you use Imatari the way I've used it, your self-care activities, you can give you 6. Patient verbalizes understanding of a plan of care. Patient consents to treatment. Patient tolerated all medications administered. Patient is able to use the callback. Patient actively participates in a plan of care, because if you teach the patient deep breathing exercises and she performs it, so patient actively participates in a plan of care. And like in the second care plan where we taught and oriented the patient to environment, patient verbalizes awareness of the hospital environment. So guys, it's that simple. So I'll be giving an assignment for us to get more acquainted, or for us to know more about this fall and fracture. I'll be giving an assignment based on this scenario I've given you. Don't plan for pain, plan for immobility for me. Send it via the YouTube and I'll be happy to mark it. Send it via YouTube. That's where I see it more, and I'll be happy to mark it. So for this case scenario I've given you, plan for immobility and plan for fall. Don't use my techniques. Use the same Imatarid and plan for it and give me the self-care activity. And remember to sign. Remember to put a date. You can snap from your document if you have it, and you can also type. So that's all, guys, about fall and fracture. Really, really simple. Even the assessment is same as any other assessment. Okay, guys? So I'll be happy to get feedback from you, and I'll be happy if you do a care plan on fall and immobility for me, and I'll be happy to mark. If you have any question, pop it up. I'll see you in my next video, hopefully next week. And until then, keep passing your Osce exam. Success to everyone. Bye, guys.